Good afternoon, good evening, or good morning, depending on where you are. So this is the sessions about the research on the COVID-19. I'm Will Witt from the Freedom Story. I'm your host for today. And in these sessions, we have Lucy McCray, Director of Strategy of the Freedom Story, who will do the presentations and be sharing with us about the COVID-19 impact on the vulnerable populations and the research that we have been conducting. And I think we just see that there are people still logging in, so maybe just wait for 1 or 2 minutes, and then we can start. So a couple of house rules. So if you are not speaking, please mute yourself. And if you would like to speak or ask any questions, would be appreciated to wait until Lucy finishes presentations, and then please raise your hand by using the reactions at the bottom of your screen, and then we'll go one by one according to who raised your hand first. So we have about 1 hour for these sessions. I think Lucy will do presentations, and then once she finishes the presentation, then we can start the Q&A session. So depending on how active we are, but let's see that we can finish at about maybe 3 p.m. Thailand time, so which is about an hour. So I think we are getting quite a number of people in this room already. So maybe we can start. I think in this sessions, maybe what I would like to first introduce Lucy, and maybe in order to do justice, maybe I let Lucy introduce herself, about her background, and then we can go into the subject matter. How about that? Should we start with that, Lucy?
That's great. Yeah, thank you very much. And thank you everybody for coming today. I'm really excited to share with you our findings from our research into COVID-19. My name is Lucy. I'm the Director of Strategy here at the Freedom Story. I've been working with Freedom Story for about 4 years, and I've been living and working in Thailand for about 6 years. Very excited to share with you guys today.
Thanks, Lucy. So as we all know that the COVID-19, as its name, it started since 2019, and now we are in 2021. It has been dragging on, and we have seen some progress in some of the countries, some relapse, and the impact have been devastating. So there are over 100 million of people who have been infected by this, and millions have died because of the COVID-19. So I think in order to maybe check the bottle for Lucy, this has, unsurmountable impacts on the life of people. And there have been research shows that those who have been impacted by the COVID-19, the list can maybe come back in around, some months, could be 6-7 months, that will be able to come back to the same level that they were. But for the poor and the needy, it could take years that they would be able to come back to the same level that they were before the COVID. But many would not make it. And in these situations, we are seeing that the situation we are facing with in Southeast Asia or in Thailand, we have seen that there are many people who lost their job, either full-time or part-time. There could be Thai, there could be non-Thai, there could be stateless people, there could be migrant workers. There are peoples who have been trying to go back to their home country, but they could not because the border was closed. There are those who are desperate in their country of origin and trying to get into Thailand, and have been subject to a lot of difficulties in trying to get into Thailand to try to work. There are those who are in Thailand, but they cannot find any job. They lost their job, but they couldn't find a new job. And there are many students who cannot pursue their study and have to stay at home. There have been some effort by government trying to help some population, but other population, they cannot. So the vaccines are supposed to be here, but they are not here. There are also limitations in terms of the hospital capacity. So all these are the context that we are facing, now, and we have been facing this since 2020. So I think this is the situations that we are very interested to look what's the nexus of the impact of COVID-19 and human trafficking or the anti-human trafficking efforts, like many of us here that are working on these issues. So in these sessions, I would like to ask Lucy to walk us through this into the research lens and how we would have been able to maybe look at this systematically and from the academic point of view. And I think more importantly, I think that's leading to the discussions on, so what's next? What can be done? So with that, I would like to ask Lucy to start her presentation, please.
Absolutely. Thank you so much, Virwit. That was a really great overview of the impact that COVID has had here in Thailand over the last, almost 2 years, 18 months, really. So earlier this year, from around January until June, Freedom Story had the opportunity to conduct some research into the impact of COVID here in Thailand. We really wanted to look not just at the impact of COVID in general, but at the impact as COVID has had on those vulnerable populations that Virwit was just mentioning, specifically populations that are at risk of trafficking. How has COVID increased or impacted or decreased people's vulnerability to trafficking? So brief background on Freedom Story to give you some context. Freedom Story was founded in 2008 to prevent child trafficking and exploitation in rural parts of northern Thailand. We have an office in Chiang Rai. We also have an office in Nan that we opened last year. And our programs are really based around combating the three main vulnerabilities that we find for child trafficking here in northern Thailand, which are poverty, low levels of education, and then social marginalization, including things like family breakdown, ethnic minority status, statelessness, or perhaps even things like HIV or other health issues that challenge the community. So in order to address those three main problems, we have three programs: an education program that provides scholarships to at-risk students, as well as mentorship to them and their families, a way to provide advice and to give them support. A human rights program that raises awareness not only of what trafficking is, but also what causes trafficking and helps people understand their rights and how to access their rights with the government, as well as a sustainable livelihoods program that helps to generate income for families that are living in poverty through small-scale agriculture and permaculture. Our main target groups are ethnic Thais, ethnic minority groups here in Thailand, also known as hill tribes, and migrant workers from Burma. And with those, these are very rural contexts that we work in. So rural Chiang Rai and very rural parts of Nan, where the communities we work in are often very isolated. So the methodology for this program or for this research really was to collect basic information on the impact of COVID at the community level. So we wanted to know how people, specifically women and children, were being impacted by COVID-19. So we had a specific gender lens, as mostly women and children are more vulnerable to trafficking, but also because women and children are more vulnerable in general to various impacts in the community. We also had a focus on what were the aspects that make people vulnerable to trafficking in general. So we wanted to take a look at how employment has changed, people's economic situation, how education and technology has changed, how social protection, including things like gender-based violence, sexual violence, emotional violence, psychological violence have changed, whether there's been an impact on how people can access health services, as well as taking an important look at how COVID has impacted mental health. We wanted to really capture both quantitative and qualitative data for this. And so we had a mixture of focus group discussions, in-depth interviews, as well as quantitative surveys that were distributed in the community. So we conducted over 40 in-depth interviews and focus group discussions, and we conducted surveys with 158 participants between Chiang Rai and Nan, where we're working. In order to best represent the community that we work with, we used a stratified purposive sampling, which basically means we took the community and broke it down into things like ethnicity and vulnerability factors, and made sure that our research respondents were reflective of that group of people, as well as taking into account looking at things like wanting to interview people with various roles in the community, including teachers, village leaders, and community health workers as well. As I said, this is already a very vulnerable group. And so that's something that's very important to keep in mind when we're reflecting on the findings, is that this is not reflective of the wider population, but the group that we're working with is already very vulnerable, already has a pretty low safety net, and so is already pretty vulnerable to trafficking and exploitation. So brief background, the demographic background of the people that we worked with was about 50% ethnic Thai, 26% ethnic minorities, including groups like the Aka, Hmong, Thai and the Karen, as well as about 17% migrant workers from Burma and 7% migrant workers from Laos. As you can see from this chart, there was quite an emphasis on two different ages, one being kind of youth, being that 10 to 18 age range, as well as the working age range, so around 23 to 60 or 23 to 50, made up the majority of people who are our respondents. The reason that we focused on that was because we wanted to focus on the children that we work with and their families. Those are the main targets from our population, children that are vulnerable to trafficking, as well as their parents and their families and how they have been impacted. In terms of people's vulnerability factors, and I will note here that respondents could fit into more than one category, and this was a self-reported response. Around 5% of people were single mothers. Again, 26% were minority groups, around 20% were cross-border migrants, and 55% of people said that they reported that they felt they fit into no vulnerability group. Brief background on COVID in Thailand. Virwit gave a great background just now, but Thailand actually was the first country that had a confirmed case of COVID outside of mainland China, and that was in January of 2020. There was a larger outbreak again in March of 2020, and like much of the world, Thailand went into a pretty strong COVID lockdown between March and May of 2020. However, compared to the population and compared to other countries, the caseload of COVID cases, confirmed COVID cases in Thailand, was relatively low for the first wave. It was only between around 100 to 150 cases per day, and that lasted for around 1 month. There were 0 cases per day confirmed by May 13th, and we remained at 0 cases for over 200 days. There was a brief second wave in January of 2021 that impacted mostly migrant workers and was pretty well secured or pretty well contained to the area around Bangkok. However, a third and current wave of COVID began in April 2021 and has been the most significant in terms of caseload. Outside of Bangkok, there hasn't been an extremely strict government lockdown, but I would say the economic and social impacts have been the greatest from this most recent third wave of COVID. For example, to give you a context, today, I think there was around 13,000 confirmed cases. There's been around 10 to 11,000 confirmed cases for the last week and around 100 deaths per day. So, maybe not as many as some of the bigger countries that have experienced huge surges in COVID, but certainly enough to put a significant strain on the Thai healthcare system. This is also in this third wave, the first time that a lot of students are having to study online for longer periods of time. Last year, they might have gone online for a few weeks or maybe even a month. Now we have students who have been online completely for almost 2 months. With that, I want to touch really briefly on some of the limitations of the study. So as I mentioned just now, the third wave began right as our research was taking place. So I think it's possible that people in the community had not fully felt the impact of that third wave as much. And we were also working with some recall bias as we had asked people to recall things that had happened almost 1 year prior during the first wave, 1 year or 9 months before the research started during the first wave. So there was definitely some issues with the timing of the interviews. If possible, we would love to have done it at a later time, perhaps after this third wave when people maybe felt more of that impact. I think there was a bit of selection bias. We worked with people that are part of our program, and as a result, we had a very rural demographic of people, so they perhaps were not feeling the fullest extent of the government impacted or government directed lockdowns in their communities. And then the third part, I think, was a social desirability bias. So in a desire to sort of save face and put their best foot forward, and also perhaps because some of the interviewers were external to the community, people were perhaps less willing to open up about some things that might reflect badly on them or their communities. Okay. Moving on to the findings. So I wanted to break our findings down by the SDGs, which are the Sustainable Development Goals. And the reason I wanted to do this was because I feel that COVID is really going to impact our ability to achieve the Sustainable Development Goals. They were already very lofty and high goals to begin with, but I think COVID will almost certainly be putting countries like Thailand back on its progress to achieve those goals. So the 4 goals that really were related to our research were SDG 1, which is about reducing or no poverty, SDG 10 about reduced inequalities, SDG 4, which is about quality education, and SDG 3, which is about good health and well-being. Again, these are goals that are supposed to be set for 2030. And these are also known as the global goals. So beginning with SDG 1, no poverty. Before COVID, people were really not reliant purely on government subsidies. While they might have been living a subsistence lifestyle, more or less people in the community were able to make enough to put themselves to continue their lives and to sort of live their day-to-day life, even if they were living in poverty. But with the closure of workplaces and the closure of the borders, Thailand closed its borders in April of 2020 almost completely. There were huge closures of various workplaces, restaurants, hotels. Almost everything was closed that was not essential was closed during the first wave. And 17% of the total Thai economy relies on tourism. And so it was very impacted by the closure of the borders and the loss of tourists. And things like construction struggled to know how to keep people safe and social distance during the first wave of COVID. Different occupations, however, were impacted differently. For example, those who are daily wage laborers, which is the majority of people that we work with, face an even more unreliable income. For example, fewer days of working, perhaps lower wages for the days that they did work. Meanwhile, people who were farming their own land or working in agriculture might have seen a decreased impact on their income. For example, crops continue to need to be planted, they need to be harvested, but their impact came later as people struggled to either send their crops off to markets, or once they were there, they struggled to be sold. And so people I talked to talked about things like, the cost of selling a pineapple going from 10 baht to 2 baht, or not being able to sell things at all. And that includes people who are producing agricultural goods for both internal sale in Thailand as well as external sale. There was a big decrease in both. So if you look at this quote that we have here in the bottom left, this is from one of the members of one of the minority groups. The work has not changed for farming, but the obvious impact is that the produce cannot be sold because there's no people coming to buy and sell to the market. There are problems with travel and distance. People rarely leave the house to buy products. The forest products that were obtained before are now not selling. There's no alternative jobs for hire. That forest products that she's talking about, a lot of people who farm their own land, they will go and forage things in the forest for supplemental income, because farming often is an annual one-time income. But she was saying even that supplemental income they were trying to find had been impacted. Hours were cut as well for people who worked hourly jobs. For example, students of ours who worked in restaurants or coffee shops often had their hours cut as there were fewer staff needed for fewer customers. This meant that some of the students tried to do things like find secondary income, but again, with limited success. We also had reports of people like migrant workers and ethnic minority group members reporting unpaid wages. In one instance, a migrant worker mentioned his boss had not paid his wages for quite some time, and the boss had claimed that it was because of the economic impact of COVID. In addition to work-related changes, there were also changes in family situations that meant that a lot of people couldn't go to work like they had before. For example, many of the migrant workers that we work with are used to sending their children back to their home country to be educated or cared for by grandparents. But because of COVID, they were not able to send their children back. And so there had to be somebody at home to watch their young children. And again, because people are at home all day long, there were increased expenses in things like food, household costs, education costs, which we'll come to later, and travel costs. As you can see here in the upper left corner, 37% of respondents reported either being unemployed, having their wages decrease, or having to leave work due to changes in a family situation. So that's a pretty significant number there. And again, this is another quote from one of the people we talked to. Some of the impacts were unemployment at least. This affected maybe half of us. Others engaged in independent trade, but lost at least 80% of their income. And that was, again, one of the ethnic minority group women that we had spoken to. An important thing here is that vulnerable groups, the most vulnerable groups, people like ethnic minority groups, stateless people, and migrant workers were without safety nets during this time, putting them at high risk. And speaking of vulnerable groups, that brings us to SDG 10, our second finding about growing inequalities. So again, vulnerable groups were the most impacted: migrant workers, ethnic minority groups, and stateless individuals. While there was some government support for people with Thai citizenship or Thai ID cards, helping to pay, for example, for certain costs or reduce certain costs at eligible shops, they had a 50-50 scheme where the government paid 50 and people paid 50%. Not everybody could access that government support, and not everybody was eligible. So only Thai citizens were eligible for that support. However, even people who were Thai citizens, like many of the ethnic minorities, they were eligible for these schemes, but they couldn't access them. That's because people living rurally or ethnic minority farmers don't have the knowledge about how to sign up for these schemes online. Often people would go to sign up and there would be, thousands, if not millions of other people signing up at the same time for a limited number of slots. And so you had to have been online at the right time, ready to go. People don't always have reliable access to the internet, like we'll come to in a minute. And some people who are not fluent in Thai, or Thai maybe is not their native language, might struggle to be able to fill in the forms. Some of the schemes required steps such as verifying your identity at a local bank, for example. If you're living in a very rural area and you don't have access to free transportation, then it's going to be very difficult for you to go and present yourself at a bank and verify your identity in order to access these schemes. And indeed, if you're living in a rural area, not all of the shops or parts of your area might have signed up to the schemes, so it might not really be as beneficial for you. And again, there's a quote here that from one of the minority group members saying that, the Hill tribe or ethnic minority groups don't expect cash assistance from the government because they live a more subsistence lifestyle to begin with. And again, speaking of inequalities, 34% of people reported increases in unpaid household responsibilities. So again, speaking of a vulnerable group of people, particularly of women, many of them felt that they had increases in unpaid responsibilities. For example, elder care, child care, and other household responsibilities that then also prevented them from going to work in order to find more income for their families. Another quote here from a minority group member: products resulting from work cannot be sold because no one is buying. No one called for wage labor jobs like before. Those who do not have a Thai ID card or Thai citizenship cannot receive any assistance from the government. So having said all of that, there were certainly growing inequalities between people who were citizens and people who were not or could not access government support. We did not find any large differentials in exploitation, including gender-based violence for for these different groups that could be attributed to COVID. I think that part of the reason that we did not find any large differences in gender-based violence or in exploitation at this time is because of the timing of the study, and also because of the sensitivity of the questions and the desire to sort of, like I had said, present socially desirable answers, and perhaps that we had interviewers who were external to the organization help with some of the interviews. People were less likely to tell a more honest answer because they hadn't built trust up with that person. Okay. Next slide is about SDG number 4, which is about access to quality education. So we found really that families were not equipped to provide access to online learning. They lacked both basic equipment to access online learning as well as reliable internet. If you look here in the upper right-hand corner, 55% of respondents, when asked if they could support their child to study online, said that they could not support their child to study online. Another 45% said that they would need access to reliable internet. I think the problem really is that both parents and children lack knowledge and skills related not only to really to accessing the technology that provides access to online education. For example, navigating Zoom, which is often entirely in English, navigating things like Google Classroom. There's also a challenge related to the actual quality of learning and the retention of things that are being learned. When online education is one way, as many of us know, it's very difficult to ask questions. You can't really provide clarification or seek answers to your questions if you're a student. And then the chart here at the bottom, you'll see when we asked people, what would you need in order for successful online learning? 44% of people said that they would need reliable internet. 8% of people said that they would need content in their native language, or they would need training in how to access the online education. 2% said they would need a computer, and 2% said they would need electricity. But 37% of people said that they did not know. That might have been because at that time their students had not yet been studying online, or because they just weren't sure. To just expand briefly on education again, when we're talking about the parents and the students that we work with, 73% of the parents of our students and of the respondents never had access to education or only had access to some primary school education. So when we think about, as I'm sure many of you know, how online education really requires the parents to be ready to answer questions, to almost help to co-teach the child, many of the children that we work with have passed their parents' education level already. And so parents might not feel equipped or might not be able to answer those questions around the academic content. There's also a problem where, online education requires parents' time to sit with the child and ensure the child is paying attention, or to at least, make sure the child is attending classes. That requires a parent to be at home to care for the child, again, taking them out of the workforce. Online education obviously completely removes the ability to have social or group work, which impacts children's ability to, socialize and develop soft skills. And many teachers felt that online education was just not possible where they were, especially in the rural areas. And so they opened up the schools for in-person, socially distant online education, which really risks the infection rate of COVID going up. And also the teachers mentioned risk them looking as if they were vectors of infection as well. Teachers themselves also mentioned that they felt that they were not equipped or trained for online education. Here's a quote from one of the teachers that we interviewed. There's been about an 80% increase in workload. There is more work from alternative methods of teaching and learning. Online teaching doesn't work if the student does not have an online connection or an electronic device. But having students return to school is a problem, since there can have to be social distancing in the classroom. Young children are not disciplined enough to stay socially distant all day. Plus, teachers need to make sure they do not become an image of potential source of the spread of COVID. So like I was saying, a lot of teachers felt that there was more work for them and that they were concerned about spreading COVID. There were also increased costs that were reported, both because children would usually have lunch given to them at school and parents now had to pay for that extra meal at home, as well as costs related to accessing the internet, perhaps purchasing a smartphone or a device or purchasing an internet connection that you would not normally have had. And again, all of these things were our findings show that they were even more true for the most vulnerable people. As one of the parents said here in this quote, parents cannot help their children with online learning because parents do not have knowledge of various technologies and academic content used in online learning. So there's a challenge both around the academic content and the technology used to access online learning. I want to take a moment here to address online exploitation. As we all know, online exploitation and online sexual exploitation of children is increasing. I can't remember exactly the stat, but our friends over at Hug Project are going to be hosting a webinar tomorrow on this, and I'm looking forward to joining. But there were many more cases reported to TICAC, the Thailand Internet Crimes Against Children Task Force, last year than there were before. I believe they were able to rescue or provide relief to 2 times as many victims as a few years prior. And when we asked the parents of our students around what they thought was the risk of online education and online exploitation, and whether or not there were any risks with children spending more time online, almost 50% of them said they felt there was no risk, and 9% mentioned a risk of sexual exploitation online, which to me, I think underlies the fact that many of these families and many of these parents don't understand technology and the internet enough to understand the risks that are also involved in accessing the internet for their children. But one of the parents did mention that they simply do not have the time to constantly monitor their child's use of the internet, which is obviously completely understandable, but does put children, and Thai children in particular, at a very high risk of sexual exploitation. Okay, our final section is about health and well-being related to SDG number 3. So we found that COVID information was available in various languages. It was available in Thai, in Burmese, in Lao, for example, even in Shan in some areas. However, not all of that information was always reliable with online sources and people sharing things on social media, and that can cause fear and paranoia amongst the population. Our research also found that vulnerable women and girls in the ethnic minority and migrant worker groups, including single mother families, while they had increased awareness of how to prevent the spread of COVID, it meant that they were less likely to access public health services unless they felt it was completely necessary. So if they had symptoms, perhaps not even symptoms of COVID, but they had some other health issues, they preferred to stay at home rather than go to the hospital because they were concerned about being in contact with people who had COVID or exposing themselves to COVID while traveling. This was especially true for pregnant women who now had to go to appointments on their own rather than having someone who could attend their appointments with them. And this often caused them feeling stressed and anxious, especially for those that are not fluent in Thai or who do not speak Thai natively, having to access the health services in a language that was not their own. And for those who live in remote villages, having to pay for transportation to take them to and from health services or the hospital became even more expensive and even more difficult during this time. There was limitations on who could visit and who could enter into hospitals. And so it was definitely something that held people back from accessing healthcare. But perhaps the most important finding we had related to health was related to mental health. So allow me to just take one moment to explain these 2 graphs. So on the left here is pre-COVID, and on the right is after COVID. And I'm sorry, I made these slides on Canva. For some reason, it won't let me change the key on the left-hand side. Please note that it goes up to 75 on the left and only up to 40 on the right. I couldn't change it, don't ask me why. So we asked people a series of questions and asked them to rate whether they felt these ways always, most of the time, more than half the time, less than half the time, some of the time, and not at all. So we gave them a scale of how often they felt this way over the period before COVID or before the pandemic and after the first and second waves of COVID. So we asked them things, for example, like, I have felt cheerful and in good spirits. I have felt calm and relaxed. I have felt active and vigorous. I woke up feeling fresh and rested, and my daily life is full of things that interest me. So those were the questions that we asked, represented here in the different colored bars. As you can see very clearly, almost 80 to 100% of people felt those positive feelings always or most of the time before the pandemic. And that drops down to almost 40 to 60% of people saying they felt those positive feelings only half the time or less than half the time. Whereas previously, almost everyone was feeling positively almost all of the time. As you can see, there's a much greater emphasis on the latter half the time, less than half the time, sometime, or even not at all after COVID. So there's been a huge impact on people's mental health during this crisis, perhaps because they are anxious about the future, they have fear of the unknown, people are not sure how to protect themselves from an invisible threat like COVID. I'm sure many of us have felt this way as we have all experienced this pandemic, but I think that this has really been a strong impact for vulnerable communities. And an important thing about mental health in Thailand is that Thai culture is very communal. And so Thai culture really relies on social interactions with those around you, and that mental health and talking about mental health is often stigmatized in Thai culture. So I find it very unusual that people would be so willing to share their mental health struggles during this period or the change that they have found in their mental health. And I find that actually even more remarkable for these findings. Obviously, as we all know, lockdown really isolated people. And I think it really clearly raised a lot of fear and a lot of stress and has really resulted in a decrease of quality of life. Again, I hate to sound like I'm repeating myself, but these things were even more true for vulnerable groups like single mothers and people in ethnic minority and migrant worker communities. Okay, finally coming to the end here. So what are the implications from our findings? First, I would say, poverty is increasing. Income is more stable than ever. People are having to eat into their very small savings that they might have had. People's debt is increasing. More needs to be done to help to alleviate poverty, generate income, and provide relief, particularly to groups that are missing out on the government relief at this time. Inequality is also increasing. The vulnerable people are people who are the most impacted by all of these factors. Education and access to quality education is decreasing, particularly for the most vulnerable. And as children are out of school and online, I believe it'd be difficult for them to perhaps have the motivation or the desire to go back to school when you go back in person. If they feel like they can't keep up with their peers, I think that could cause a decrease in children returning to school. So we need to follow up to ensure that children can access online learning in a consistent and meaningful way. And we need to ensure that children don't fall through the net when schools return in person. Finally, mental health is strained, stress is increasing, quality of life is decreasing. People are very stressed and under a lot of anxiety at this time, and children feel that even if they are not so stressed themselves. Children feel that, they know their parents are stressed, and vulnerable people are becoming even more desperate for improved lives. The impact to improve their lives, and that could be a way that puts them at risk of trafficking. Impact of all of these things is being felt by rural people as time goes on. The third wave is happening now, as many of us know, as we live here in Thailand, and we believe that that will have a bigger impact, and all of these impacts and implications that we've shared today will have a bigger impact as time goes on as well. All of these things that I've mentioned, all these things that we've touched on, can cause increases in vulnerability to trafficking as income decreases, especially for those that are most vulnerable, education decreases, the quality of education decreases, vulnerable groups are struggling to keep up, stress is increasing, quality of life is decreasing. People are going to start to want to look other places to improve their lives, and that could lead them to risky migration, to taking jobs that put them at risk of trafficking, or being lured into various sectors that have high incidences of trafficking. That's it for my presentation. I wanted to say a huge thank you to JICA Thailand for the support for this research, and a huge thank you to my team for helping with this research. It was great to see how our community has been impacted and how we might be able to support them in the future. Go ahead and stop sharing my screen so I can answer some of your questions.
Thank you so much, Lucy. That is really, really good. Well, I mean, a full disclosure to everyone, even though colleague of Lucy, this is the first time I'm seeing this presentation. So well done. And also, like Lucy said, thanks a lot to Lucy and the research team, research assistants, the staff of the Freedom Story, the communities, and also I think without the support of the Japan International Cooperation Agency, JICA Thailand, it would not have been possible to have this study conducted. So thanks to JICA for that. So I think now we have been listening to Lucy about the result of the research that have been conducted during this period. So just like to open the floor for us to share your thought about the research. If you like part of the research, or if you think that there's certain things that you would like to seek more clarifications or contribute to this, or maybe recommending on maybe something that you had wanted to see but haven't seen in the research, and maybe that could also be good follow-up research that can be done. Or if you have done some kind of similar research in your organizations or in your area of works that you would like to share and compare, that would also be interesting as well. So the floor is open. So if you have any questions, please feel free to do so. You can just speak up, or you can raise your hand to the reaction using your digital hand. Okay, maybe we need to have some warm up. So maybe let me start asking Lucy some questions, and then we can also jump in. So I think in this research, I think you have done a great job in getting to the communities and then trying to get the most out of the limitations that we have. When we are looking at the impact of the COVID situation, I think some maybe asking the questions about how many people have been trafficked during this time, or the rate of trafficking have been increased or not during the COVID, or if there's anything that you found during your research that I think would be interesting to people to hear. Yeah.
That's a great question. While we didn't touch on prevalence of trafficking directly, if I had to answer the question, I would say, online exploitation of children is certainly increasing. We have seen that through reports from TICAC. We have seen that through our own work with Freedom Story, with children in the communities that we work in. And I would also say from the experience from our human rights team working with the migrant workers, there seems to be increases in labor exploitation and things like wage theft, and some increases in trafficking. Now, I couldn't necessarily specifically draw those to COVID, but we did have one or two instances, for example, like I shared, where the employer had said, oh, I couldn't pay you because, I'm losing my profits as well, and things like that. So that would be my opinion. I would say also, we've seen perhaps not increases, but things like smuggling across borders have become more obvious as borders are clamped down more. Obviously, Thailand is a country with relatively porous borders, but as the borders have been officially closed, things like migrant smuggling have become more obvious over time.
Okay, yeah, thanks for that, Lucy. I think this is also a very important issues that you mentioned. What I would also like to hear about it, but I think there's also a question from Brian Lippincott. His question is this: with the increase in all form of vulnerability due to COVID, how can organizations address these issues in meaningful ways?
Hi, Brian. Thanks for the question. So Freedom Story focuses on trafficking prevention. So that's always going to be what comes to my mind first. But if we really are able to address these vulnerabilities and prevent these people that are now more vulnerable from being trafficked, then actually we're saving the work for our coworkers who work in aftercare and intervention and rescue down the line. So for me, I think if we can mobilize to help prevent this vulnerability from turning into a trafficking situation, that would be the best way to address that. As I said, I think one of the key things that's increasing here is poverty and inequality as well. So really targeting our programs for those that are the most vulnerable, as well as providing income generation programs or at minimum direct relief, things like Freedom Story was able to provide. We call them bags of joy, things like dry rice, noodles, soap for people to help decrease their household expenses during this time. I think, not just raising awareness of trafficking, but also providing people with ways to overcome their risk of trafficking is a really meaningful way to address COVID. But I also think, as trafficking shifts online or becomes more online, it's going to be more of a challenge to prevent child trafficking. And so ensuring that children are not overly isolated, that they do have someone to turn to. And then, of course, our wonderful colleagues continuing to do the work that they're doing with TICAC and preventing online exploitation in that way as well.
Thanks, Lucy. If you look at the latest U.S. Department of State TIP report, Trafficking in Person report, I think one of the reasons that Thailand was downgraded from Tier 2 to Tier 2 watch list is how the Thai government treat the migrant workers, especially during the COVID time. I don't know if you have any information that would be able to expand on that, maybe lack of services from the Thai government to the migrant workers that you have seen during this research.
Yeah, absolutely. Very understandably, the Thai government was only able to provide relief to those who are Thai citizens. And so lots of people missed out on that. People who are stateless, ethnic minority groups, people who are migrant workers from Burma. We worked with many migrant worker groups who faced loss of income because perhaps their employer had moved them from one province to another, and then they had to quarantine and they weren't able to go to work. We also saw, particularly during this third wave, groups of migrant workers test positive because they live and they work together. So they are more vulnerable to COVID. And I think really missing out on that government support meant that they did not have the safety net. They really lack the social safety net to bounce back from this vulnerability. And many of them, as we have found in our work, either don't know what their rights are with the Thai government or they don't know how to access them. So they might have rights to unemployment insurance through the social welfare office, but they don't know how to fill the paperwork in or who to speak to, or they may not feel confident in their language abilities to go and do that themselves.
Mm-hmm. Well, thanks a lot, Lucy, for that. There's also been lockdown in Bangkok and in some other places in the country that the migrant workers are being trapped there, and there are also reports about them not being properly treated as well. I think the situation is also under monitoring, and I think that maybe this is the research that can be further conducted. Thank to Krista Crawford for your questions and also a suggestion. So I will be looking at the mobile app as well for for questions. But maybe your question is very interesting. Maybe I address that to Lucy here. From Krista, one of the most surprising things to me was seeing women from Thailand go to Burma to work in the sex industry, since the sex industry in Thailand was shut down due to the COVID. This is the opposite of the usual migration from Burma to Thailand. Do you have any insight or similar dynamics?
That's a great question. I actually hadn't heard about that directly myself, but I do know that hundreds of thousands of migrant workers left Thailand at the beginning of COVID last year. And as you say, the sex industry has essentially been shut down in Thailand due to bars and clubs and things like that being shut down. I do know that that's forced thousands of people out from Bangkok into provinces that are very rural to go and try and find jobs that perhaps don't exist, either because they left those areas to find jobs in Bangkok to begin with or in bigger cities to begin with, or because due to COVID, those jobs no longer exist. So I would say that's a very interesting, like you're saying, the opposite of the usual migrant flow from Burma to Thailand. But as other countries are more open, I've heard of neighboring countries that have had greater success with vaccinations. I wouldn't be surprised if people in their desperation are seeking to go to places that are more open, particularly, as I mentioned, those borders are very porous. And so I wouldn't be surprised if we saw people in their kind of vulnerability and out of their desperation seek to go to these other countries.
That's also a very interesting trend. And I think there are other research that I have read before that, the migration from our neighboring countries like Burma into Thailand, maybe looking at the lower wages in terms of the sex industry. But in Burma themselves, I think in those areas and also in Laos, where there's a casino on the opposite side of Chiang Rai, they are looking for the Thai sex worker, commercial sex worker to work there. And that's actually for the higher level of income. So maybe that's also one of the reasons why it become attractive for those commercial sex workers in Thailand who could not find the employment in Thailand because they locked down, the close down of the entertainment business. So then they go and look for job in the casino or in places on the Laos or Burma side. I think this is also another interesting questions that I've seen from the WOA app. Does the research indicate whether the COVID crisis has helped create any positive, lasting changes to the way we respond to the problem of human trafficking and modern slavery? So being on the positive side, being optimistic. Yeah, do you see that?
Great question. Thank you, Krista, for that question. I think for me that the thing that was a positive outcome from this would be encouraging people to continue or perhaps improve upon the targeting of our services and the targeting of our programs. So really ensuring that we are meeting people that are the most vulnerable, because those are the people that are being impacted the most. Even if perhaps they are harder to reach because of language barriers or physical barriers, ensuring that those people are the ones that are getting the programming, and that those people are the ones who are getting, obviously, like I said, Freedom Story focuses on prevention. So ensuring those people have access to prevention programming that would allow them to overcome their risk of trafficking. I also think that there's a great opportunity here for kind of like a hybrid between mental health practitioners and anti-trafficking. Like one of the strongest and clearest findings that we saw was that people are much more stressed, they are much more distressed, and they have a lower quality of life. And so it would be really interesting to see how mental health programming, mental health awareness could be implemented for trafficking programs as well, and for the wider community, as for sure. But I would say those were the two positives that I took out from the current research that we found. And there was a positive there that we didn't find any increases in gender-based violence. Now, that doesn't mean that there haven't been increases in gender-based violence. I was surprised to see that while people are more stressed and everything else has increased and the quality of life has decreased, there weren't increases in gender-based violence that we found. As I said, it's a very sensitive personal topic, and perhaps people were not as willing to share that with an external party. But the feeling that, in other countries, they saw huge spikes of domestic violence or child abuse, but we didn't find that in our particular study for this period of time. Yeah.
Thank you, Lucy. And thanks, Krista, for the question as well. If you have any questions, please feel free to ask your question or raise your hand, or you can write in the chat box as well. I think we still have maybe about 5 minutes to go. If you have any questions or if you'd like to contribute to the discussion. So I think we are among friends and colleagues, and this is like a peer groups that we can work together. So please feel free if you would like to contribute anything or ask anything.
I believe that translators can also translate from the other languages into English. So feel free if you want to ask.
Yes. Yes. If you would like to ask in your language, then the translator can translate into English as well. You can use that service too. Yeah. In the meantime, maybe while you're still thinking about the questions, I can ask other questions as well. I think this is a very interesting topic. I can really go on for hours. But yeah. If you look at the research that have been conducted in northern Thailand, and if you would like to maybe passing on the message to our colleagues who are working in the anti-trafficking elsewhere, what would be like your key message to them that they should be looking for when they are working during this pandemic?
Yeah, great question. Obviously, the findings we did were related to, our particular context, but I think the things that we found are likely universal, at least across Thailand. Vulnerable groups are becoming more vulnerable. People that perhaps you could say were already on the fringe or the edge of society are being left behind. They are not accessing government support. They are losing their income and losing their jobs. They don't have a safety net to rely on. They are not accessing education. That was very clear. Children cannot access online education in these rural contexts. And finally, that mental health and health center to some extent access is being increased. As I said, I wish we had been able to do this research perhaps the second half of this year or even the first half of next year to see how this third wave, which has been much more significant, might impact people and their responses. But I would say, as COVID remains with us, Thailand, many of you, I think, looking at this list of people live and work here in Thailand. Thailand is struggling to vaccinate the population in a quick way. Thailand, I think, will be dealing with the impact of COVID, economic impact of COVID, social impact of COVID, the mental impact of COVID for a number of years. And so, especially as, around the world, we're seeing increases in things like the Delta variant. And so it's certainly not the case that, we've begun vaccinating and now COVID is no longer going to be an issue. COVID is going to continue to impact us, I believe, for many years to come. And many of these impacts and findings that we found are almost preliminary because of that reality that COVID is going to continue to impact these vulnerable populations, in particular, for a number of years. I believe while the better off parts of society might be able to bounce back, as you said, Virat, at the beginning, they might be able to bounce back or move on more quickly. These vulnerable groups and vulnerable populations are going to be struggling with these impacts for much longer.
Thank you very much, Lucy. This is true. I think that we are still going to be in this situation for quite some time. And we are still not off the third wave yet. And then there's some forecast that we may have the fourth wave coming up soon. But I think maybe like for the final questions, if we want to look at the bright side, that what would happen, I mean, if the COVID end, what would be the post-COVID-19? What would be maybe the new normal, the next normal, and what do you see the situation would be like? I mean, if the COVID end, the country become reopen again, what would be the impact on the vulnerable population? I mean, I think you said something related to that already, but maybe your vision of what's going to happen and what it's like, and then what we can be prepared to do as an anti-trafficking organization.
Yeah, that's a great question. I hate to be sort of like the bringer of bad news, but I believe, obviously, no real way to predict the future, but we see that after economic crises, for example, the Asian economic crisis in the 1990s, after economic crises or other crises, like there is an increase in trafficking because people are desperate to improve their situations, and desperation and a lack of economic choice lead to greater instances of trafficking. I also believe that employers are going to be incentivized to exploit their workers perhaps more than they had before, because they will be, losing their profits as well. And so I think, people are more desperate, employers are more incentivized. As borders reopen and the country sort of returns to the new normal, I believe that definitely exploitation could be increasing at a pretty rapid scale as people seek to improve their financial situation from how it has been, fairly devastated during this period of time. And so as the country returns to normal, or as the world returns to the new normal, I think it's really important not to lose the motivation or the work that we've been doing to help protect vulnerable populations, because we can see that as time goes on, they're going to become more desperate. They're going to have fewer options, perhaps children, like I said, not returning to school when the time comes. We did see that in a number of students last year. And so, lower levels of education generally leads to less economic choice, and less choice leads to a higher likelihood of exploitation.
Yes. With that, I would like to thank Lucy and for this really useful sessions. I mean, for sharing with all of us about the research that have been conducted, and also shedding light on some other areas that are also really important for all of us who are working on anti-human trafficking. I also would like to thank all the attendees to these sessions for your interest in the research of the COVID-19 and the impact on the vulnerable populations. So I wish that you also learned something from this and then taking some point back home. So thanks a lot, everyone, and thanks, Lucy.
Thank you all so much. It was great to be with you.
Thank you. Thank you.